Welcome to part 5 of our 7-part series on organizational and occupational psychiatry topics for residents. If you haven't met me already, I'm Parker Schwab. I'm one of the current PGY4 psychiatry residents. At the timing of these videos, I do want to thank my assistant author, Sam Gardner, and then my advisor, David Morrison, for assisting with creating this curriculum. Before we begin, I do want to go through some disclosures. We currently don't have any conflicts of interest or financial disclosures at the timing of making these videos. In addition, we're going to be using the term org psych or organizational psychiatry to encompass both psychiatry and psychology terms and topics. But please note that these fields are distinct and often overlap, but to be mindful of that as we go through the lecture. So in section 1, we went over a brief overview of organizational occupational psychiatry, what it is. And then in section 2, we went over why it matters to us as physicians and then also to our patients and clients. In section 3, we went over the U.S. Surgeon General's framework on the components of a healthy workplace. And in section 4, we went over how to take a work history of our patients. And today, in section 5, we'll be going over treatment plans. But before we get to treatment plans specifically, I do want to talk about how if a patient experiences a job loss, that should be considered a psychiatric emergency. And during that time, we have 4 essential tasks. The first would be to triage and treat emergencies, so screening for things like suicidal thoughts, or active suicidal thoughts, homicidal thoughts, or escalating substance use, which may require urgent treatment. Once we've done that, we want to treat symptoms medically and psychotherapeutically. As part of this process, we want to help patients recognize their own vulnerability, identify feelings, and enhance their support system. Psychotherapy may be an important modality in their treatment. In addition, we want to help them realistically evaluate job prospects and assess their current workability, including potentially even thinking if they need to take disability, if there are any mental health disorders that are currently impairing their ability to work. When it comes to mental health in the workplace, the CDC has several recommendations, both from a provider standpoint and from an employee standpoint. So for providers, they recommend that we screen for symptoms, offer treatment, and connect our patients with services as appropriate, including referrals to psychologists, social workers, physical therapists, or occupational therapists, and other practitioners as needed. From the employee standpoint, they recommend that our patients encourage their employer to offer mental health resources, participate in these resources if they're offered by their employer, and then also serve as wellness champions for others that are experiencing something similar. Oftentimes, this is recommended maybe to be outside of their own workplace because it can be pretty sensitive to disclose some of their mental health issues at their workplace. But when they do become a champion, they encourage them to share personal experiences to reduce stigma around mental health issues, offer peer support, encourage others to seek support, and then also practice empathy with those individuals. In addition, they recommend that the employees adopt wellness behaviors, including healthy diet and exercise, maintaining good sleep hygiene, meditating and practicing mindfulness, and then also making sure they're socially engaged. The World Health Organization also has several recommendations when it comes to mental health in the workplace. They mostly focus on from the employer side. So they state that an employer should offer reasonable accommodations for mental health, including flexible hours, extra time for appointments or extra time on projects, support from their supervisors. In addition, they recommend that they offer return to work programs and clinical care access, which has been shown to be associated with reduced mental health symptoms. And then they recommend that employers offer supported employment initiatives to provide continued mental health and vocational support. So from both the CDC and the World Health Organization, these are great guidelines that we can point to from the practitioner standpoint to advocate for our patients, especially if they're experiencing a workplace that's not offering these types of resources. We can point to these specific things to say, hey, this might be something that you should get your employer to offer, or we can even go to the employer directly and ask them if they're able to provide these. So when it comes to treating our patients for mental health disorders, I like to come at it from a lens of maybe becoming a coach for our patient with the goal of optimizing wellness and life balance. We're uniquely suited to help our patients assess their goals, explore past meaningful experiences, discuss their skills and talents, and then also explore their home life and what that might mean to them. And this makes us uniquely suited to try to help them navigate this environment and identify new goals and pursue those goals, and maybe find new areas of growth. So I won't belabor all of this because I know most of psychiatric residency or psychiatry residency is about um, diagnosing and treating mental health disorders, but it is important to just note that we as practitioners are um, required to screen, diagnose, and treat mental health disorders, anywhere from mood disorders all the way to personality disorders. This encompasses all of the DSM diagnoses. I won't go through these in detail, but I did put them here for reference. Again, this is not an exhaustive list of mental health disorders, but ones that we commonly see in practice. I broke it out into the various categories and proposed interventions. Again, this is non-exhaustive, but it might be good places to start. I won't go through all of these in detail, but each disorder category does have some general recommendations, which might be something to think about, or an area where you can at least begin with your patients. The one thing that I do want to point out specifically is that when it comes to work, we have other things that we want to explore with our patients when it comes to treatment options. So we really want to think about screening for time management issues. So asking questions about if the patient's meeting deadlines, if they're requiring extra time at work, if they're having a lot of distractions at work. If so, potential intervention would be to limit time on social media or other avoidance behaviors that might be going on. Maybe recommending that they set specific wake up times and work in times to constrain their work to specific times during the day so that they can be more focused during that time. If they're having a hard time with work-life balance or finding meaning in work, maybe recommending that they try to explore their hobbies or interests and scheduling more time for those outside of work. Also encouraging time with loved ones, and also talking about trying to exercise regularly and maintain a healthy diet, which all can be important things to help with mental health symptoms as well. I think one important thing to point out here is that it's critical to screen for food and housing insecurity as well, as that can be an important area of distress or source of distress for people. So you want to ask them questions that help identify if they're having any difficulties with finding a stable income source, if they have any disposable income, and if so, how much, if they're having issues with transportation, if they have dependents or a number of dependents that they have to support, and then also if they live in like in a food desert. And the main treatment intervention here is to know about local resources and offer them as available to the patient. So that was a very brief section, but hopefully it kind of got you thinking about the additional things we want to think about when it comes to work and treatment options. I didn't go through all of the treatment options for the various psychiatric disorders because I know that we get most of that in training, and it was a bit out of the scope of this presentation, but hopefully it was helpful for you. And now we'll move on to the next section.